Cool. Well, hello everyone. I'm Riva Kajangu, CEO and founder of Neo Sophia, and our platform is AI Ranger. Building AI Ranger really for parents to give them a 360 view of the developing child, and also give them resources into what's going on inside the child, and how can they step in and kind of get the insights and so go forward, whether it's dealing with conditions like autism, which we're going to talk about, and any other developing issues or just emotional development over time. So that's what we're all about, and we're here to support parents. And I have here with me Kelly Gold, and she'll introduce herself, and then we're going to jump into some questions. So tell us who you are, Kelly.
Hi, Riva. Thank you so much for having me come on and speak with you. My name is Kelly Gold. I am a parent educator for Fulton County Baby Skipway. Also work in conjunction with Georgia State University Centers for Leadership and Disabilities. I am a mother of two sons. My oldest son, 21, has high function autism. And I love to help parents that are starting out initially on their journey through disabilities and allowing them to know that I too went through it, and you can get through it when you know the right resources and you have the right support.
Oh, cool. Thank you. Oh, and also I forgot to mention, I'm wearing this sling because I got surgery, but I'll be okay. We're gonna go through it. So we're gonna jump into question number one. So question number one is pretty straightforward. So what early signs first suggested autism, and how did you initially respond to it?
Sure. So I noticed that Justin wasn't babbling, and I knew some milestones just from having nieces. Was the first time mother, so I didn't know initially, what I should be looking for. But I just sense, even going to the grocery store, seeing babies close to his age, doing different things, pointing, trying to verbalize a little bit. He did none of that. So I would say that was the first sign, no babbling. He would get very frustrated, didn't trust many strangers because he was fearful, because he couldn't really communicate even as a baby. Sometimes you can point out what you want. He couldn't do any of that. I would say I initially responded by trying to figure out, where do I seek some help? I wanted to help my child. I knew right away he needed help, and there should be some help out there.
Gotcha. Thank you for sharing. And now jumping into the next question. So now that you kind of understood the process, and how'd you navigate, let's say, once you find out the actual diagnosis of your son, and what would you tell parents just starting in the process, right? They're going through what you just experienced, like this, noticing all the symptoms, and then they go get it checked out. And then how do you navigate that initial diagnosis?
So I navigated by, I knew instinctively to find support. And sometimes that's just, people assume your family, your spouse, but you sometimes have to go past family and the spouse. So I found support groups. And with, you find solace in parents that are going through what you're going through, or either been what you've been through, or currently going through. And so I would find support groups. I joined North Fulton Autism Support Group here. Families are, well, I should say parents of children with disabilities are by far the most knowledgeable, most helpful groups of people that you can entrust in, helping you through your journey. I also navigated with our developmental pediatrician, gave us great insight as to, hey, he will talk more. These are the things you should do. So I would adhere to suggestions from the specialists. We knew applied behavior analysis therapy, had never heard of it, but he recommended that. So I looked and researched into that. But I would say support groups, not discounting families. Families are great, but them in conjunction with support groups. And you can find support groups in your area, especially nowadays. You can just search via your zip code and put in what you need, or even AI. You can find whatever you need nowadays. It's much easier than like the early 2000s. So
got you. Nah, cool. Thank you for sharing that. It is true. It does take a village, and especially if you have a strong community, like you mentioned, of people also going through the same thing. That's also beneficial, just long term, right? Outside of just dealing with the doctors one-on-one. And so next question is here, what were the biggest early development challenges, right? So you mentioned this was your first time experiencing this. So how would you say, or how would you even categorize, like, what was the biggest early challenge that you faced?
Communication. So I would say his speech was the biggest, that's the biggest challenge. I wanted to make sure my child could speak. And then the more information I found out about autism, I realized some kids will never speak, but our developmental pediatrician ensured us that he has a skill set. He would actually grunt. So he wouldn't babble, but he would grunt. So that's vocalizing somewhat, but he said he will eventually. So I would say delay in speech, and then that delay led to behavior. So that's which led us to apply behavior analysis therapy. Let's replace behaviors with him having a way of communicating with us. So I would say that, and I found the appropriate therapy in ABA to assist us with that. And without that, I think it would have been challenging because you couldn't really address the speech until you address the behavior. So, and we were fortunate. Our first therapist was an ABA therapist, BCBA, excuse me, and she also had a degree in speech pathology. So we were fortunate because we had
Got
a
it.
sibling. Yes, yes.
No, that's great. And then maybe diving into kind of the specific therapy. So you mentioned ABA, of course. Now, were you also aware of other types of therapy, or was ABA kind of the standard one offered, or like how do you know which one to go with, or was this based on just a recommendation by the doctor?
So I would say I knew speech because he had problems, communicating. I didn't know much about occupational therapy because sometimes they recommend OT because sometimes they'll have gross motor skill issues. I was so focused on him communicating, I didn't realize about, okay, gross motor skills, how his gait is, how would he be able, could he throw a ball? So I found out from the specialist that the developmental pediatrician actually gave me a good template. Since my son had the behavior issues, ABA was a good place for us to start initially. I had never heard of that. So lo and behold, for his issues, ABA was the foundation, and then we can move on to, and then speech and OT were offered in public schools. So I did like a half a day with therapy, private therapy, and then half a day for him to get social skills too. Because with autism, sometimes they have issues with social skills. But my son never really did. He gravitated to talking, trying to talk back then to people, but he was in his own world, so he needed some reinforcements.
Got you. Which I'm sure it wasn't. It was challenging through and through. But I would say, how did your parenting approach evolve as your child entered adolescence, right? Because you started growing, you started therapy. How did your parenting kind of evolve with that?
Within when he entered into adolescence,
Yeah.
it evolved because I allowed him to be more independent. With children, kiddos with disabilities, parents have a tendency to hover and cover, or prompt. I didn't want to make him prompt dependent, but I was realizing as he was reaching adolescence that I was kind of prompting him too much. I said, let me allow him to be independent more. And that's when I made a conscious effort to say, okay, I'll be here if you need me. However, you can do some problem solving on your own, because I realized this is the next step into becoming a young adult. And by him going through puberty, I think he really wanted more independence as well, because he had those hormones, and so he was hesitant to. He would say, I know, mom, just like a neurotypical adolescent. It's like, I don't want to hear it from anyone. So allow him some space, and I think that's where I saw more growth, and I was so happy about that. So I was more of a gentle parent then, allowed him to evolve and mature just as I would his younger brother as he reached adolescence, with guidance, still guidance, but not smother and cover as much.
Got you. So maybe a new question here. So your kid who's an adult now, he's much older now. Like, how would you say the timing, right? Like from 3 to 7 or 3 to 10, how's your parenting then versus like 10 to like 15 or to 20?
Okay, so 3 to 7 was more very hands-on, very, very hands-on, correcting him, checking him, just making sure, I was like almost drilling, assignments and everything. But I would say by 15, I realized he was learning, had set the foundation. So I could allow him to be able to learn his way without me saying that you study this, make sure you study this again, because I knew he had challenges with academics. And I always kept a tutor as well. But by adolescence, I just limited the amount of time we spent with a tutor. Instead of like 2 days a week, it became once a week, because he was, everything was starting to click. What the foundation I laid allowed him to, have his own wheels to turn. Sometimes you don't know if your wheels are turning because you have someone here in the shadows to jump and help you. You know what I mean? So
Yeah.
I just kind of, fell back. So I would say definitely I was more hands-on at the beginning, but by 15, I was not as hands-on.
Got you. Cool. Yeah, that makes sense. Now, kind of jumping into more unique challenges, like what were, or at least what are some unique challenges and strengths you observe with high functioning autism compared to non-high functioning autism?
So by Justin being high functioning, no, his autism could seem invisible at times, but when you spoke to him, maybe by sentence number 3, you could kind of tell, because he had some auditory processing issues to work through as well. He was used to more so talking about himself, more so like you would never know something was wrong, but if someone else the other person started to talk about themselves, it kind of lost interest or eye gaze and everything. So, but it would be more challenging for people to determine or decipher that he had a disability compared to someone that, would be a little bit more obvious, or they're not looking at you at all. So I would say they can't see the disability at times. And then the strengths are that they aren't looked at as different right away either. So it's the pros and cons to that. As he's gotten older, the communication, being able to converse better, because I want to say this, Riva, that it's important to change therapy and your approach to therapy, like speech, as your child gets older. So it worked as a young child, didn't work as an adolescent. So I had to find a younger speech therapist that maybe looked like him and he could relate to. He saw him as a peer versus a speech pathologist, because he's like, I don't want to go to speech. I don't want to do this, So that's important to find therapists that meet your child's needs when they're at a certain age. You can outgrow certain therapies as well. So be cognizant of that. So we'll work from, 4 to 7. It's not going to work from 15 on up, because we still have a speech pathologist. He's a 30-year-old man and Justin's 21. So he's able to relate to him. They have a lot of things in common. So I want parents to keep that in mind as well. Just keep your therapies growing with your child as well.
Got you. Yeah, which leads into the next question on how did you foster independent and self-advocacy as your child approaches adulthood? And I said that because you mentioned around, teenage years, of course, they become more independent, but how did you prepare for that or foster for that, knowing that, your child was high functioning autism? Like, was there like an actual understanding, like, okay, I have to kind of let him be more independent, or was it just happening naturally?
Absolutely. It was a little bit of both. So it happened naturally because I noticed he was doing things without me having to ask him. He also had a better understanding, which built more independence. Also, I allowed him to figure things out, because I would say when he was about 15 years old, almost 16, he would come to me and ask me things. I said, well, have you thought about it? Allowing him a chance to figure it out. So, well, think about it first and then come back to me. So I started to ease away because I wanted to make him not so codependent on me. So I saw a little bit of things that he knew to do, he could do on his own instinctively, after, being trained or knowing about it. But also if he would come to me and it's something that, this is a lesson for him to figure things out versus asking mom all the time, because I said, what if mom is not available? What would you do? So relying on his own knowledge and teaching him to think things through first before asking questions. Also finding a program such as the Georgia State University IDEAL program for young adults with disabilities. That really, I would tell you, Riva, that really shot up the independence level with him, because I was frantic sending him to downtown Atlanta, but it taught him to, read street signs, ask for help, with his peers or with, they had peer mentors or the administrators, just finding programs to help him to evolve as well outside of just outside of once he finished high school. I wanted him to have somewhere where he could be um, watched over, but they really pushed independence. So finding programs that help take care of your child, but also push independence.
Gotcha. Yeah, that makes sense, and that's applicable to really any parent. Really, just finding a right group for your child so that they can, thrive, in the world
Absolutely.
themselves.
Yes, it's so true.
Now, so we know it's not challenge. It's challenging, right? What you kind of dealt with, for 21 years. You said now, right?
Mhm.
Like, can you share? Was there a breakthrough moment that gave you kind of hope during the difficult times? Like, oh man, like there's hope at the end of this, right? Or did you just feel like it's like tough forever?
So I would say actually it came kind of early that gave me an inkling of hope. We had just started the applied behavior analysis therapy when he was like almost 4. And he was also doing like preschool at a public school for half a day, Monday through Friday. And it was his 4th birthday. And I remember he said a full sentence. And I was like, so it was like there was hope. That would say that was a breakthrough moment to, allow me to know that we keep up these therapies. Also work with him at home. I want to reiterate that as well. We can't just send our kids to therapy or rely on therapists, rely on school. You need to learn tools yourself. So I will also, I'm so sorry I didn't say this early on, educate yourself, speak with a therapist and ask, what can I do at home? Because it takes an entire village. You can't come home and then it's like, she says, don't allow him to um, use sounds, make him say what he wants. So if you don't do that training at home, it's pointless because whatever they learn in therapy, you just need to reinforce it, just like, a regular school age kid. That's why you have homework, you have assignments, you have to reiterate it at home. So I would say the breakthrough, getting back to your question, would be at 4. That's what made me realize, okay, he will talk, he will speak clearly. There is hope. And that gave me hope to keep pushing through because it showed that that early intervention was already working. So that's why I tell parents now, just get started. It may be slow or it may surprise you. It may happen a little bit quicker, but we said that one sentence and then it was like you get stubborn all over again, but that gave me some hope.
Got you. No, that's great. Thank you for sharing that. So I mentioned this at the beginning. So we'll be sharing this with parents that are either going through it or will be going through it in the future, right? And
Yes.
I know you've kind of have experience in this area. So what would you say? Which support system proved essential? And you mentioned at the beginning you started with one therapist, and then switched later on. So can you just break it down, like maybe in time, like which system worked early, and then midway through, and then maybe now that's helping that you noticed?
Definitely. So I would say at the beginning, definitely any early intervention programs such as Babies Can Wait. They can actually nowadays actually connect you to the right therapies. That's when you can determine what resources may work best for your child, and it's free to a parent. There's always opportunity if you want to have more services. You can do private as well. So I would say at the very beginning, research early intervention in your area. And they have numerous programs for Fulton County as well as I know Cobb Douglas, Babies Can't Wait, and Gwinnett as well, and other counties. So then I would say school age, work closely with the school. You decide to send your child to kindergarten, in public school. Make sure you have a good IEP, work well with them to get the resources within your school. Also, if your child has challenges with academics, seek a private tutor, just once a week. That's what I did with Justin, just to reinforce. I'm not a teacher per se. I know how to do the basics, but I would always keep like a tutor in the vault. Like, okay, I need someone to help me understand how he learns, because he definitely was a puzzle piece where the puzzle pieces were, lined differently. He was a visual learner. So I would find special education teachers that would, kind of do tutoring on the side. So they helped me out because Justin struggled with reading. So I found teachers that knew how different strategies and teaching him how to read. Once he had it, he had it. And then I would say middle school, that's when you're starting adolescence or puberty. Just I determined then that I want a larger classroom size. I didn't think he was ready for it, so I went private just for middle school. I'd done public for elementary, but decided to do private in a smaller classroom setting so that he could get his puberty together, along with having reinforcements. And then he mentioned to me his 8th grade year in the private school. We did 6th, 7th, 8th there. He said, I want to go to a big school, Mom. I'm ready for a bigger school. So we went to a huge high school, and he did well. He meant what he said. He was ready. So just know your child, know your child's strengths, and then build upon that, because every child is different. And, you just have to talk to them and see what they want as well. So I also didn't force Justin to do a lot of things. And if I felt like it was something he needed, we would talk about it and say, hey, I know you're thinking OT is not needed anymore, but guess what? And then we even incorporated physical therapy later. He was like, Mom, I don't see, what this is doing for me. I said, well, it's strengthening, fine motor skills. And that's when he realized, what, this is good for me, because it was working him out physically, which helped him mentally, because I believe in mind, body, and soul. And so I said, why not? Let's try it. Let's try it. And if you don't like it, we'll cut it. He loved it. And so just know your child as they get older and they're able to communicate their wants and needs, they will tell you in their own way. Either type it in or using different apparatus or equipment rather, to try to help them verbalize it. Just listen to them, and also watch. You can tell when it's time for a transition or change for them, and just say, hey, do you still like doing this? What would you like to do as well? And then kind of make them a part of the decision-making process as well. Because
Gotcha.
he told me I want to go to college, and I'm thinking his senior year was like, college. They weren't in the cards at first, but I found an inclusive post-secondary program. Lo and behold, Georgia has a nice amount of them. So, just continue. Early interventions key. Advocate for your son or daughter. Advocate. I would say I became his biggest advocate, because I was able to verbalize when he couldn't, and then now he's able to, advocate for himself. He's had self-advocacy classes, as a matter of fact. So he can tell me a few things now. Yes, so the sky's the limit. It may not seem like it, but it can get better. It will get better.
Gotcha. No, thank you for sharing that. It's kind of hard to wrap it into like one single advice you have for parents. And I'll share maybe this, right? We talk to a lot of parents, and some of them, as you know, they may be early, like, oh, I'm not sure what to do yet, or I'm noticing signs, but maybe I want to wait and see what happens. Maybe they grow out of it, or they're just not unaware of like, oh, I should get early testing if something look off, right?
Right.
So there's parents in different levels of the spectrum, so to speak, in understanding how to deal with any condition children may have. So maybe from that perspective, what advice would you give parents? Because we're going to share this out and as part of our expert advice, so that parents can have this resource. What would you tell them to kind of like hold on to?
I said it never hurts to get your child tested. I mean, so if you feel like, oh, he's just starting off slow, well, let's just confirm it. You know what I mean? Testing is always key, and you can either confirm or just, discredit that your theory that something's going on. So I would say always do the testing, utilize your resources that are available to you. I'm telling you, we started this journey in early 2000s. He was born in 2003, so I would say mid 2000s. I mean, there are so many more resources, so many more people like me that are willing to talk. You don't have to look under a rock to find, support groups and
Yeah.
everything. Like I said, that's what helped me out. It was just almost like just making sure that I didn't lose my mind. I wanted to be there for him and for myself, and also pour into yourself as a parent. Don't feel like you're alone. Don't feel like this is an incurable disease. You can help your child. The younger they are, the more you're able to mold the mind or help the mind develop or push it to developing a little bit better. And why not? Why not try, right? So
Mhm.
versus just let me wait and see. Time is of the essence. Early intervention is key. We don't have time to wait or waste. So
Got you. Now, you mentioned maybe a final question here. You mentioned lonely. Did you ever feel lonely at your time at all? Like,
I did, because I had friends with, neurotypical children. And so I was very lonely. And that's why I sought those support groups, because there were people and parents like me. And you never want to feel like, oh, my child has something wrong. It's almost like a stigma. Everyone wants a healthy baby coming out normal. And no one's normal nowadays.
yeah.
But, it was a stigma of having a different child, and it was a lonely world. So that's why the support groups helped me a lot in finding out additional resources outside of just the developmental pediatrician and the therapist, just
Mhm.
resources on even for parents, because parents need help as well.
Mhm.
Um, and getting through all of this, and also not getting overwhelmed, because a lot of stone at you. You want to try this. Heard about the hyperbaric chamber, chelation, all these things, and it's like sometimes you just have to stop and pause and say, you can't, cure, because back then you're thinking, I can cure this. It's not a cure. You want to help your child more so, not cure them. You know what I mean? It's to
Yeah.
help, because they come out beautiful in no matter what form they come out in or whatever they have, they're beautiful. So they just learn differently, or they just have a different issue. So, they're beautiful no matter how they were created.
Gotcha. Well, Kelly, this has been a tremendous pleasure. Thank you so much for sharing your story, your background, and of course, everything you've shared. We'll share it out to other parents, and hopefully they can learn from this, and we can, turn out to have more parents that turn to be like you, because I think you're
Thank
inspirational,
you.
and we truly appreciate your time for helping us with the AI Ranger. And so we look forward to talk to you in the future. But thank you again for your time today.
You're welcome. Thank you.